Hi, and welcome to Wow Talk. I'm Donna Cappuccitti, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness. Hi, welcome back.
Yeah, welcome. And welcome back to all the students going to school.
Oh.
It's starting. If it hasn't started for you already,
it's the most wonderful time of the year.
Yes, it is.
For the parents, anyway.
Yes. You can believe it. This is the first year for me that not one of my children is going back to school.
Wow.
I know.
Wow.
That's something, right?
Nice.
All 3 college/university grads.
Nice.
Hey.
That's like halfway to being an empty nester.
Yes, that's right, halfway. I don't think they're ever leaving, for real. But I can't help but get those feelings I would get every year at this time when I start to think about, oh my goodness, getting the back to school clothes, all their supplies, and starting to worry about the lunches and what am I going to do this year to make it innovative yet healthy. So, Dr. Gustin, where do we start?
Well, I can say in hindsight that my kids were noticeably healthier than many of their classmates.
Okay.
And I didn't really do anything big and dramatic. Of course, I fed them well and prioritized sleep. And there were a few supplements we took, nothing too dramatic, but they did very well. Like they've never had an antibiotic. And so what we did was working.
Yes.
And our needs vary nutritionally. So especially here in Canada, we don't get our sun or fresh produce that's local grown in the winter. Mm-hmm. So that's the big thing, is to know what your body needs. And my top 3 are zinc, D, and vitamin C. Okay. Seasonally for the immune system. And I didn't really prevent colds or flus in any other way. It was more like if somebody had the sniffles, everybody got a dose of something.
Oh, smart. Yeah.
Mm-hmm. And to intervene early. So whatever you have at home. So it's good to have a little collection of things at home so that when it's a Friday night at 10 o'clock and somebody sneezes or somebody has a sore stomach, you can boost up the immune system or kill the bugs before they reproduce.
Oh, that's key. Right?
Yeah.
Before they reproduce.
Yeah. Early response is the key.
Okay. That sounds really great. Mm-hmm. Really great idea. Mm-hmm. And something that's simple to just have on hand.
Yeah.
And it's a good time of year to check to see what you have and to get your supplies ready. Mm-hmm. And so I was mentioning the lunches. Mm-hmm. I imagine it's so important to pack some sort of protein and healthy snacks. And so what did you used to do for that?
It varied all the time. Like every other mom, I would take advantage of those programs where you can pay to have a lunch 1 or 2 days a week. Yes. So that they'd have something warm.
Yes.
They didn't want to drag thermoses in the winter. So it was nice to say, okay, 1 or 2 a week, you're going to have something warm, and we'd negotiate something healthier. And they were good about that. And on the other days, my kids really enjoyed having like a non-structured lunch. Like I almost never made a sandwich for them. Right?
I love that.
Yeah. So they really liked a random collection of fruits and vegetables and hummus and cheese.
Yes, that's a great idea. Almost like a little charcuterie board they brought in.
Exactly like that.
That's a great idea.
Definitely, right? So they would have their little carrots and their hummus or veggies and dip, and then I'd add cheese to that. Or they loved Mexican, so we would make the salsa, the cheese, the sour cream, and then the healthy lower salt chips. So it was very, sometimes they'd have leftovers.
Yes.
But it was not complicated. I'd give them an apple. I didn't think about it that much. And of course, I'd start them off with a decent breakfast. They'd have their fruit and their grains and protein at the beginning of the day.
Yeah, that's a big one. I remember the school that my children went to, their elementary school, they would have an early break, the morning recess. I can't remember. It was close to 11, I think, or if not before that. I can't remember exactly. But it was under the thoughts that some children aren't hungry in the morning. So then they don't get hungry till a bit later. So this way they're not waiting until noon to have their lunch. They're getting it earlier.
Yep.
So So I thought that was a good idea.
Definitely.
Yeah. So what do you do in that case too? You have a child that doesn't want to eat, just because not everybody, not all schools will do that sort of a thing, have an early break.
Well, same thing. You would pack them a random collection of food. So you'd know that in there you have something that's a protein and some carbs, whether it's some good quality crackers, chickpeas. Some kids will just like to just munch on chickpeas with their fingers, and whatever your child likes that's healthy.
Yes.
So,
yeah.
And then sometimes we would make a chili and put it in the thermos, but I didn't want this to be a source of stress for me, but I wanted it to be healthy. And
that's the thing, right? A source of stress. I guess we could also, back in the day, like you said, using leftovers is always a great thing. So when we were preparing, or when you are preparing your dinners, to keep that in mind. And then if you have the leftover protein for the next day, or you can make sandwiches with things that are left, and and
a lot
salads.
of kids like smoothies now too.
Yes.
So if they're having a short snack and they don't have a lot of time, or you have been busy and didn't have time to be creative and chop up fruit, you could always give them a protein-based smoothie and a piece of fruit. So at worst case scenario, you have to come up with 5 different ideas. So there's nothing wrong with every Monday's the same. By the time it's Monday again, they're not going to remember.
Oh, that's a really good point.
Yeah, keep it easy.
Yeah, keep it easy, keep it simple, make it stress-free for you. And then you were talking about having your little kit for, let's say, something comes up to prevent things. Do you recommend supplements and vitamins, like just generally speaking, for students?
As Canadians, yes, it is good to have a multi through the winter, because our food was picked green in some other country, or it was frozen or canned or jarred or preserved in some way by the time we're eating it. And so the quality of the nutrients in our winter diet is much less than it is through the summer. That's why we need the supplement. Plus also the mineral content of our food has declined sharply in the last 30 years. By about 50% less minerals. And that's why we're just putting back into the food what should have been there. And people our age know that food tasted different when we were kids.
Yes. Oh my goodness, did it ever? Yeah, that's a tough one.
Yeah. And but every company has a different recipe for what they put in the multi.
Okay.
So you can get very different content of calcium or zinc or iron, etc. So I usually, if it's my patient, we would have tested their nutrient status, and I know this child needs extra zinc and that child needs extra magnesium. So sometimes we piece it together a little bit.
Okay.
Or if they're pre-puberty or a teen or very athletic, they need extra protein. So a lot of kids where we live play hockey, and they're racing straight from school to some sports or hockey arena. So you need not just healthy, but quick and easy. Some people are eating in the car.
Okay, that reminds me, all 3 of my children danced, and yes, I would have dinner prepared. I'd be picking them up right after school. We'd be heading over to the dance studio, and yes, they would be eating in the car. Then, of course, when they were done after 8 o'clock at night, sometimes 9 o'clock, they'd be hungry again when they got home, and they'd be eating a late dinner.
Yeah.
You know, that's exactly how it went down year after year. My goodness. I also wanted to touch on backpacks and how I think we've heard more and more about children having back pain because of the weight. I remember in my day, and similar to your day, I remember carrying our books in our arms, like Marsha Brady, like the Brady Bunch, right? Like I'm going backpacks. We never used a backpack. Whereas I couldn't believe the weight that my kids carried with their textbooks and things.
Well, my daughter's in university now, so she's got an iPad. She's got a brand new iPad. She's really proud of herself this week.
Yes.
So she's convinced me that all her textbooks are virtual. And so hopefully, at least at the university level, the weight of the textbooks are less of an issue than they have been before. But when I was a student, each one of my textbooks was a good 3 inches thick.
Oh, yes.
Right? Like,
same.
Yeah.
Mathematic ones. And everything.
Yeah.
Oh, my gosh, yeah.
So if it's not the backpack, then it's tech neck.
Exactly. That's the other thing.
Yeah.
Yeah.
Yeah. And with girls, if we have a one-sided purse, you're better off with the backpack because at least the weight is distributed evenly between the right and left side.
Oh, that's true.
So people who are not mindful of this might find themselves in need of a chiropractor here and there.
Yes.
But ultimately, don't create the problem in the first place. Fix your posture.
Mm-hmm.
And some of these kids, they lie down on their bed with their laptop to do their homework. So they're not even sitting at their desk.
Oh, that's right. Yeah. Yeah. So those are things to be mindful of anyway, now that we're getting back into the school year.
Definitely.
So there's that. Proper shoes as well.
Mm-hmm.
I mean, when you think about it, they're on their feet a lot during the day. They've got phys ed. We have to think about their feet.
Yep.
Her foot health. Anything else you can think of?
Indoor air quality.
Oh, yeah.
I mean, once we go indoors, we close the doors, we close the windows. So sometimes kids are allergic to the dust.
Mm-hmm.
Or if they're in portables, there might be mold issues.
That's a big one.
And if they're in a new building, these new schools, any new construction off-gases chemical fumes for a good 2 years.
Oh, man. Lots to think about.
Yeah.
So what does one do then? Okay, so let's say, because you can't really control what's going on in the school.
No.
So when they come home, what do? What would you say?
Well, you just have to see what is the challenge and how to reduce it, right? You can't do anything, let's say, if you're allergic to chemical smells, and you can't, well, maybe you can change which chemicals are used to clean the school, right?
Yeah, that's a big one.
You could ask the teacher to open the windows for a few minutes. Or just when it's recess time, go outside.
Get outside.
Just,
make sure.
If you're affected by the school's indoor air quality, then go outside as much as you can. Give your lungs a break and do some deep breathing outside for like 1 minute, 2 minutes, and go back inside.
Okay, that's a good one.
Yeah.
All right. Well, I'm sure there's tons of other things we could touch on, but is there anything in particular before we sign off?
The stress. I find that these days, these first few years post-COVID, I find a lot of students at every age group are suffering, still recovering with their mental health. So just be very mindful of mood changes and changes in appetite and energy and their social circle, especially, of course, online. It's a different world now, and it's that much harder, I think, on parents.
Oh, gosh.
Definitely.
Well, yeah, and then, I mean, the whole other one would be bringing in the social media and everything, and then there's it doesn't end at school.
No, it doesn't.
No,
it doesn't.
It just carries on. So that's a whole other topic.
That's another podcast.
That's another one. But anyway, thank you again for listening, and
let us know if there's any topic you'd like to hear about, because we're more than happy to have some topic ideas. Thank you.
Yes, and happy fall.
Bye.
Bye.